Assalamu alaikum wa rahmatullah. For today, we'll start with the new session. It is about health education. So we will come to health education in the community. We'll see the objectives that we will cover during this session. So the first objective, we will define the term health education and the related concept, define the various learning domains in chapter 11, which is coming in your textbook in page 363 to 366. Explain the community health nurse role in teaching at 3 level of prevention. Review the background history of health education information department in Ministry of Health, which is in your course syllabus. And this is the objective of health education and the information department. Explain the responsibility of health education and information department in Oman. Then highlight the main activities achieved by the health education department since its establishment. So there are this required textbook. You have the required textbook and you know it, no need to mention it. And you have some website that you can go to it, which is the Ministry of Health, and you can go to Health Education Department and see what is there also. About the definition, health education, it is a combination of learning experience which is designed to help individual and the community improve their health by increasing their knowledge or influencing their attitude. By the way, any education, in order to see that the education is giving its benefit, it has to appear on the recipient. How it will appear on the recipient? It will appear as, who can say it? How any education will appear in the recipient of the health education, any education. ما سامع. How it will appear on them? If you are educated in a certain topic, what will appear in you? How we can identify that you are educated? Yes, it will. It is a change in the behavior. So health education, it is a change. Thank you. So it is a change in the behavior of the recipient. So the health education, it has to give a change in the health toward healthy behavior of the recipient. So education process, it is a systemic, it is sequential, logical, it has to be logical also, it has to be dependent on science-based, planned course action consists of teaching and learning. So in order to have the education properly, so it is a process of systemic process, sequential, depending on each other, sequence. It has to be logical, it has to be satisfying base, and planned course action consists of teaching and learning. About learning, the learning process is defined as a change in behavior. This is the thing that you said. So if you got the learning, it means that you have a change in your behavior, which means the behavior here, the attitude, knowledge, and the skill. When we teach you nursing, we have to teach you the knowledge, we have to teach you the attitude, how to deal with the client, and we have to teach you the skills which is required for nursing. So if you acquire that, it will appear in your performance and in your behavior. So it is defined as a change in behavior, knowledge, attitude, and skills that can be observed or measured, and that occur in any time or any place as a result of exposure to environmental situation. So when you are exposed to the situation that you learn about it, your behavior will be depending upon the education that you took, depend upon your experience. So, about patient education, it is a process of assisting people to earn health-related behavior. So, assisting people to earn a health-related behavior that can be incorporated into every day of life with the goal of achieving optimal health and independency of self-care. So we are aiming that the client or the patient is going to be self-dependent and independent from the care that we are giving. So we are telling them, we are educating him in order to be independent and to take care of his health. Why health teaching? Why we are giving health teaching? One of the causes that we have to increase the customer's satisfaction. In order to be satisfied when, as a client, as a member of the community, you have to have some information that will help you in order to promote your healthy life. You have to have some services which is provided in order to promote your healthy life. So increase the customer satisfaction is one of the need for health education. Also improve the quality of life in order to improve the quality of life and ensure the quantity of care which is needed for the client, to ensure that the client is receiving the quantity of care which is needed. Decrease the client anxiety. If you don't, do you know what's the thing that will make you more anxious? If you know what is going on, or if you don't know anything about the disease or about what will be going on, which situation will be more anxious for you or give more anxiety? Okay, yes. So if you don't know what is going on around you, in this case, your anxiety level will be high. Because of that, when we are going to a new environment, when we are going to a new situation, our stress will be high. Why? Because we don't know what is going on. But if we are educated, in this case, the process it will be, or our anxiety level will be low. Just an example which is not far away from us. At the beginning of Corona, how much stress the people were having due to that? Why that stress was coming? Why the people and also those who are in a higher authority also, they were having an anxiety related to that disease. Because their knowledge was, at the beginning, it was limited. They were unable, or their knowledge about dealing with the disease, it was limited. Because of that, they were very anxious. And the people also were anxious because they don't know at any time they might catch the virus. And they don't know the consequences might be going to death. Because also, but if we, from the beginning, if they know what is going on, what is the consequence, the plan of treatment were clear, in this case, the anxiety levels will be low in both the health worker and the patient, and the community also. All the members of the community were at stress at that time because of lack of knowledge. Because of that, they start to give a health education and to give some programs and to give some announcement in order how to deal with this kind of disease. So decreasing a client anxiety, it comes by health education. Reduce the complication of illness. Also, it will come by health education. If you know what's the thing that you have to avoid, what's the thing that you have to do in order to maintain your stability even with the disease that you are having. It promotes also adherence to treatment plan. If you know the need for that treatment, and if you are convinced with the need for that treatment, you will take it at its time. But if you are not sure about it, sometime what will happen? You will not be adhere to the treatment plan. Maximize also independency in activity of daily living, in doing your daily activity of living. Also recognize and empower the consumer also. So this is about health education. About the Assure health education, Assure it came from the first letter from those words, from analyze. So in order to give health education, we have to analyze the recipient of the health education, the learner. We have to analyze the learner. Is the teaching material to be given to those who are in school age? Is it for all? Is it for old age? Is it for a certain patient? So, depending on that, then I can prepare my teaching material, health education material. Then, state the objective. I have to have a clear objective in order to give the health education. Also, select the instructional method and material. For each health education, according to analysis of the learner, I have to structure material and the method of giving that material. Is this material going to be for a small group of patients? Is it to be for the whole population? So in this case, it is different by the method of delivery and also how it is prepared. Because if it is for the whole people, it should be through the mass media. Also use the instructional material and method. What's instructional material and method that will be used? Required learner performance. What is the required performance that I want to achieve from the learner? And evaluate the educational plan. Evaluation of the educational plan, it has to be also before, it has to be within the session itself, and it has to be after giving the instruction, to see if the people are following that or not. If they are not following it, it means that there is a defect. The defect, it might be in the planning, the defect, it might be in the material that I use, the defect, it can be in any of the processes. So I have to see, is that we, from the beginning, we said that an education or learning, it means that change in behavior of the people. So if no change in the behavior, I have to search again. What's the problem with that? Yani, once in a health education campaign in one of the countries, it is an African country, the problem was the flies, the bug. So they were taught how to deal with it, how to fight, what are the methods that can be used to reduce the number of flies. Twice a lot of flies there. I don't know exactly what was the cause, but this is the problem that was going there in that town. Or so they prepared the material for them. It was prepared by, we will not mention the name of the institution. At that time, I don't know if you remember, in the school, at the primary school, if there were 16mm films. Did you remember it? كان زمان الشريط السينما ال 16mm ينحط على they are using it in a special projector, and it will project that film. So they were using that film on a screen, on a white screen, either a sheet or on the wall, white wall, or and project that material. They found that no one deal with the problem. They tried to find out what's the cause. Do you know what was the cause? It was within the material. You know the fly? What's the size of the fly? It's a small size. The banner. They were enlarging it. So when they projected, it was a very big fly. So when they asked the people, why you are not taking any action? They said, Alhamdulillah, we are having a very small fly. So Alhamdulillah, we didn't have the one that you show us. See what was the reaction. Because of that, they didn't take any action. So evaluation, it has to be going on, and you have to see what's the fault in that. Domains of learning. In the domains of learning, when we are preparing our objective, we have to cover the 3 domains of learning. The cognitive, which is concentrate on the basic knowledge that we want to pass to the learner, so the main thinking process. The affective, which is the emotion, we have to concentrate also on the feeling emotion and the effect of the people, how we are dealing with them, how we are transferring the information to them, and also we have to train them psychomotor, how they are going to do the procedure. So it is a visible demonstration of performance of skills. So the performance with the highest level of learning, that they will be able to do what they learn. So the knowledge, if I have the knowledge but I am not using it, what's the benefit of it? So I have to use my knowledge in order to affect to change my emotion, and also in order to give me a chance to demonstrate, and will be able to demonstrate what I learn. I have to apply it on the ground. So visible demonstration of performance of skill requires some type of neuromuscular coordination. So it needs your coordination of your muscles in order to do the procedure or the skills, to perform the skills. Like if you are teaching the client how to give themselves self-insulin injection. It is not only to show them a film about how to give an insulin injection. You have to teach them how to prepare by themselves, how to count the dose, and to see them how they demonstrate that, in order to be sure that they learn the material properly. So the domain of learning, as we said, we have the cognitive, which is the mind and thinking process, including the knowledge, comprehension of the knowledge also, application of your knowledge, analyzing, the ability of analyzing, synthesis, and evaluation. If we want to go deeply in this, it will take more than 5 sessions. So the domain of learning also, the affective, emotional, feeling, and affecting, you can see also on the table at page 366 in your textbook. The psychomotor, which is the visible demonstration of the information skill required for some type of neuromuscular coordination, as we said before. So there are 5 phases of cognitive development according to the age and the stage here of behaviors. So from birth to 2 years, which is the sensomotor stage, we call it. Here, the child movement focus for self-environment, ritual are important here. So here, he will try to discover what's going around him in the environment. From age 2 to 4 years, which is the pre-conceptual stage. The pre-conceptual stage, this starts with the language development, which is rapid, and everything is related to, usually to me or to himself. So he is trying to learn all the words which refer to him. From 4 to 7 years, which is the native thought stage, which is egocentric thinking, will be diminished, and words are used to express thought. Here they will start to express how he is thinking and what he is thinking about. From 7 to 11, concrete operation stage. It is called concrete operation stage. The child can solve concrete problem and recognize other viewpoint. So the the thing which was يعني before he was unable to move it. So he is learning it as a concrete thing, as a term. Here they can mobilize it and can analyze it. From 11 to 15, formal operational stage, a child use a rational thinking and can develop idea from a greater principle, which is deductive reasoning, and apply them to a future situation. So he will start to gain the experience in order to use it in the future. And the experience from the teaching, from what will happen with him, from also what will happen, what is happened with others. Sometimes he is gaining some benefit and some new information. The cognitive learning, which is the level of it, the first level, which is, or the lowest level, it is the knowledge, which is recall, tadakkur. So it is the lowest level of learning, that we are able to recall what we learn. So state that insulin, if taken, will control on diabetes, which is provided here. We provide information for them, the illustrative nursing behavior. So in order to recall that, the patient first, he has to know that the insulin will control their diabetes. This is information. Comprehension, which is understanding, describe the insulin action and purpose. How the insulin will act, how it will permit the cell to use the sugar in our body, and it will maintain the blood sugar in our body. So we have to explain the information. Application, use learning, which is adjust insulin doses daily to maintain the proper blood sugar. So we have to teach, to give suggestion how to use learning, how to adjust your blood sugar by the diet and by the insulin, by all factors. Analyzing also, examine and explain. Here we have the illustration of the candidate behavior. Discuss relation between insulin, diet, activity, and diabetic control. So the parameter are multi-parameter that he has to take from them what they can do in the changes of his level of blood sugar. So we have to demonstrate and encourage analysis of that. What will happen with him after doing an activity? To check the blood sugar after that and to see how does it affect the blood sugar of the patient. Synthesis or integrate with other learning generated new idea. Here to develop a plan, incorporate the above learning to control his own diabetes. So according to the information, according to the analysis, according to the trail, he will develop a plan how it can work with him, because the plan is different from person to person, to promote client formation of his own plan. So we'll help him to promote his ability in preparing his own plan. Evaluation and judgment according to standard, which is comparing the degree of diabetic control outcome with the desired control objective. So here he has to compare between the desire and the achievement. which is here we have to facilitate his ability to evaluation. The other domain, which is an affective learning, which is a case study here of family planning. Sorry. The first level, which is perception, which is listen, pay attention. This is the attitude. Attentive to family planning instruction. From the nurse, direct the client attitude toward the session. Perceptive, participating in reaction. You know, when you are going to give a health talk, the first thing you have to attract the people to that topic. Might be by short story, by something. So, in order to attract them, attract their attention toward you. Then, if they are attracted, and there is a reaction will start maybe. Sometimes they will participate also and give their feedback or asking their question. So encourage the client's involvement here. Valuing, accepting, appreciating, and commits. You have to select a method for the use in order to keep the client committed to the information that we give. So respect the client right to decide. We have to respect the client also right for decision. Like, so we cannot oblige anyone to do anything even in his health. We can convince him, but we cannot oblige him. Like, we are doing mostly with health and education counseling. Counseling, it means that when we are giving health education, we will give the variety of, like, if a woman is coming, a group of women are coming for you in the clinic for birth spacing methods. There are different birth spacing methods. You have to inform them about the birth spacing method which is available, the advantage and disadvantage of it, if it is beneficial for them according to their status, according to their age, there are many things that variable that you have to deal with it according to your client. Then you have to give them the chance to choose a method. Sometimes they might choose a method, it might not be the best method for them, but it is their choice. We have to inform them about advantage of this and disadvantage of that method. If they choose it, it is their choice, but we cannot oblige. If you oblige them for each method, there might be some either side effect or untoward effect. So if they have it, they will blame you. But if they choose it by themselves and they know what's the side effect, what is the adverse effect, what is the thing that might happen to them, in this case it is their choice, so they will not blame you. Did you get the point? Are you with me? Right. Internal consistency, or organize the value and fit it together, which is understand and accept responsibility of planning for desired number of children, bringing client into contact with the role models here, adoption and incorporate a new value of lifestyle here, consistency, practicing birth controlling method if they are using a birth control method. Positively reinforce healthy behavior. We have to reinforce the healthy behavior that they are using. Nurse behavior or psychomotor learning here determine the capability, assist the client physical and intelligent and emotional ability. Then the provide sensory image here, demonstrate and explain for them. We have to demonstrate in front of them. The encourage practice here, use guidelines and positive reinforcement if they are doing the procedure well. So we have to reinforce them to do it, to see the improvement in their ability to do the procedure or to do the action, and give them some positive reward about that. Still, we did not complete 40 minutes. So, the community health nurse role in teaching at 3 levels of prevention. What are the 3 levels of prevention? Primary, secondary, and tertiary. Primary, it includes what mostly? Health education, promotion. So, develop teaching programs that match with the level of prevention. So, the health education that we develop, it should match the level of prevention according to the level of prevention that we want. If it is primary prevention, so we have to concentrate on primary prevention. The 3 levels of primary, secondary, and tertiary prevention, and we have to develop a health education for each level of them. Teach client, family, aggregates or population. Focus community also, health nurse teaching is at the primary level. So when we are dealing with the community as a whole, here mostly we are dealing with the primary level of prevention, but even though sometimes we are dealing with the tertiary one, in the secondary and tertiary it is individualized or to a group of people according to their need. But sometimes it might be the need of the community. So a significant amount of nursing time is spent in teaching at the secondary and tertiary level also. So we are teaching it at the 3 levels of teaching, primary, secondary, and tertiary. It depends upon the cases that we are dealing with, upon the community or the families that we are dealing with, and in each family, in each person, we have some primary, some secondary, some tertiary prevention that objective that we might deal with. Just we'll cover this slide, and after that the rest we will keep it for the next session. So the level of prevention here, if we are coming to the primary level of prevention, it concentrates, as we said, in health promotion and health education. So health education and the nurse teaching class on susceptible weight control according to for their age or for a teenager. So still we are in primary level, so we are teaching. They didn't have the problem at that time. So the health, it is a health protection. The health protection here also immunization. The nurse teach about the importance of the pneumonia and flu vaccine for a serious flu by immunization at the immunization clinic. So in order to raise the awareness of the client about the immunization and those diseases. The secondary prevention, mostly we are here coming by early diagnosis. Early diagnosis, it comes with screening. You know, you are going to school, at the school they are doing physical assessment for grade 1, also they are repeating it sometimes. They are doing also hearing, screening for hearing. They are doing also visual acuity. This is in order to prevent, to early discover the cases and to prevent the complication if the client is having those problems. Then promote treatment, which is treatment, the nurse teach the client to know, a negative thought, the complication of the healthcare delivery system or receiving, to promote a treatment. So here, early treatment also, it is from the secondary prevention in order to prevent the complication. The tertiary prevention, it is coming under rehabilitation, which is restore the function. So the nurse teach a stroke survival about home safety, alternative house option, how they can change some option at the house in order to prevent the further complication. Health teaching also, health promotion and education, it is coming also under tertiary prevention. The nurse teach about the importance of diet, rest, exercise, and prevent secondary problems in order to prevent the complication of that problems. Health protection, maintenance, the nurse observe the client with tuberculosis, whether they live while taking their oral medication on a daily basis. So this is our work are going to be according to the need of our client, either if it might be preventive, it might be secondary prevention, it might be also tertiary prevention of being handicapped. So I will stop at this level. Thank you. Any question?